Right.
It's scary, but you can't afford to be scared.
Right.
You've got to, especially if you're going to be in leadership, you got to step up and you've got to assess. And I know, talking to the doc, this is what he's done all his life. But you step up, assess the situation, figure out a game plan, and then you go at it. And
Yeah.
that's the way we've got to approach this COVID-19 crisis, because it has fomented so many other crises. As Black folks, we were already in trouble. The COVID-19 merely pulled the scab off some long suffering scores, the disparities in our healthcare system,
Right.
all of the comorbidities that Doc can name off. It'll take him all his hands and his toes to name them.
So
Uh,
true.
Dealing with the issues of housing and housing insecurity. Our
Mhm.
folks aren't as able to when you can talk about social distancing all you want to, you can talk about quarantining, but when you got two, three generations in a house, and the house only has a couple of rooms, and everybody
Mm.
is sleeping on the floor, sleeping on the couch, multi family members in the bed.
Mhm.
All of those things pose problems for us. We're going south in our educational system. I've been on Zooms all day trying to work
Wow.
out something to catch up on education, which
Yeah.
has been imperiled by the COVID-19 crisis. Our children have not been in school. Our children are going to probably be the most, and I mean this in a literal sense. I'm not trying to be ugly, but we're going to have the dumbest crop of children for the next few years
Mhm.
than probably since Black folks first were allowed to have a legal education.
Wow. Wow.
We're going to be set back for decades. And the only way it won't happen is for us to get busy right now, as Doc is doing. We've got to have other leadership to step up, identify that we are in a crisis
Mhm.
with our healthcare, and this COVID-19 has fomented it. But we've got to be able to look at the fact that we have education,
Mhm.
it's in a crisis. Housing, it's in a crisis. Economics, it's in a crisis. Our civil and our criminal justice system is in a crisis. Even our elections and voting is in a
All
crisis.
of it. Yeah.
We're trying to still, Congress is sitting on that rewrite of the 65 Voting Rights Act. Without that, we'll never have our proportionate representation in Congress. There's just so many things that are crazy right now. We can't assume that normal is going to get us to where we need to go. We
Yeah.
need to catch up and keep up at the same time.
Mm,
Doc?
mm, mm. Okay, wait. So wait. You guys know.
I want one thing I'm going to say. I'm going to be in the back of the bus, but I want everybody out there to know that this is Chairman Hardaway of
Yeah.
Tennessee. This is a guy that put me on the Black Caucus legislator throughout the nation. He's back my back 150%. He has my
Wow.
6. And so I want you to introduce him, Queenie. Then I'm going to be quiet and I'll let you guide the show. But hey, I got my cognac. Uh, man, with glass of, but I also got a glass of vodka and orange.
I mean, this is okay. So this is very so guys. Welcome to Bar Talks the podcast. We are actually live right now. So let me just do my typical hello, everyone that's watching. Tonight we're live on YouTube and we're live on Facebook. And, I couldn't be happier than to be joined with, first of all, it was Dr. Lane Rowland with me and myself talking about COVID-19 and the second wave. And he brought along an amazing guest. And you probably heard him as soon as you clicked on Representative Hardaway. And I am going to ask Representative Hardaway to tell us who he is, where he's from, because this was my first time actually meeting him. So, and we just started talking. So welcome to the Bar Talks podcast. Welcome everyone. Representative Hardaway, I'll let you lead, and then we'll go right into this discussion about COVID-19 because I have questions, and Dr. Rowling and myself, we already have our glasses. So we better get started.
Well, good evening to you, Dr. Rowling, and all of your listeners. I'm G.A. Hardaway. I serve as the chairman of the Tennessee Black Caucus of State Legislators, and also serve on the executive committee for the National Black Caucus of Legislators. I chair the International Affairs Committee, and that's how I ran down Dr. Rowling.
Yeah.
Also in Memphis is my home. That's in Shelby County in Tennessee. And I sit on the Ethics Committee. I sit on Criminal Justice Full Committee and Criminal Justice Sub. And I sit on the Government Operations Committee, which sees all of the departments, agencies, commissions, boards, etc. Of the state. And we also do rulemaking, and I sit on Commerce and the Business Subcommittee for Commerce. I've been working with Dr. Rowling for a while here, and thank God that we have Black professionals, those who are skilled and talented in the way that we've been able to, we being Black Caucus and the Black community, we've been able to get our own information, develop a strategic plan as we move ourselves forward, because Lord knows where we would be, we being the Black community, where we would be if we were counting on getting the proper leadership, which would include the right information out of DC and the national leadership out of there. So thank God we've been able to put together our own talent with the skilled professionals. Dr. Rowling has been magnificent in getting information to us. By the time you read it on the CDC website, or you hear it from the World Health Organization,
he's already talking about
Black Caucus already knows because he done told us.
Yeah, I noticed that about him. He's already talking about it, and so I couldn't help but I think I don't want to say stalk. That's such a horrible word, but I did track him down quite a bit because of that. I just felt that I could trust his information, and I felt that I wanted to bring him to the show so he could talk to people that look like me and you, because there are a lot of distrust out there, and not many people knew Dr. Rowling, not in my circle, and I just felt like, people got to know this man and start following him and following information that he's putting out. And to me and to many that's going to find out, he's reputable. So I do appreciate that. So I want to introduce you, Dr. Rowling.
Before you introduce me, because I think it's a very important part of life. Your father's moved on to the next world. I deal in a world will die, sick and stuff. So I want you to tell people, your audience, what you've experienced with the SARS COVID-19 about your life and your dad, and then we'll start into me, and then we'll get this thing right.
Sure.
Because I got my
Sure. Sure. So make sure you check your volume is kind of breaking up. Doctor Representative Hardaway, is he breaking up to you a little bit?
Yes.
Okay, so make sure you kind of mess with your audio a little bit, and then I'll tell those that are watching and listening my story. So I literally just returned from Philadelphia burying my father. He passed away on September 11th due to COVID complications. And I think this is probably one of the most challenging interviews that I'm actually conducting today, because my dad was my best friend. One of the things I learned during this whole ordeal is that if you have any elderly that need to go to rehabilitation centers or any of that, don't let them go, in my opinion, if they have another option. My father contracted it in one of the local rehabilitation centers. it was totally against my own personal will. I absolutely did not want him there. He was there for a broken hand and or fractured hand, and he had fallen. And I talked to dad over and again before he went in. He was COVID negative, but I talked to him before he went in and asked him to come stay with me in my flat and just kind of be here with me, and I'll take care of him. But you know, others made a decision for him to go because he was in Philly, and he did go to the rehab. And about 21 days, well, probably about 18 days later, I called him every day because many people know me. They know I talk to my dad almost every day anyway. But I called him every day, and every day he started to sound, you know, worse off, you know, more kind of down, more depressed. And then I heard his breathing started to change. And I knew then that something was going on. And whenever that happened, I became very, very frightened. I see that we've lost Dr. Rowland, but I'm sure he's coming back. But I became very, very frightened. And certainly within another couple, okay, sorry, I'm looking at information too. But certainly within another couple of days, we wound up sending him back to the hospital. At about 21 days of him being in the rehab, he goes back to the hospital, and they test him, and he tested positive, and he passed away 2 weeks to the day that he tested positive, which would have been on the 11th. And I was devastated. I was devastated for so many reasons. I never wanted him there. The fact that this virus is, it really is serious, and it really is deadly. And the complications that you experience, not every person can handle it. Not every person's going to survive it. And to listen to the nurses as they begin to tell us almost every day how things were or were not changing was traumatic for me, because I could feel and I could hear that this was not going to get better. And they really drew a picture of how this was happening, you know, like the lungs, how they were, I like to say solidifying. And I know when Dr. Rowland comes back, he can explain it a little bit better, but the lungs were just like cementing. They were no longer able to work. And that was devastating, knowing that my dad had to get go from oxygen to an incubation tube. Hold on, let's add him to the stream. And so just dealing with that, it was definitely devastating. And I'm still working through it, because it's surreal when you lose someone to COVID. And unfortunately, I lost my stepfather I'm sorry, my godfather as well this year due to COVID complications. And so it has just hit me one after the other, but my dad has definitely been the biggest blow. And so that is why we're having this conversation, because I want everyone to take this serious, and I want to learn how I can have even better practices as well in my day to day. So again, Dr. Rowling, thank you so much for joining me tonight and bringing along an amazing guest, Representative Hardaway. I really appreciate it. So let's get started. I want everyone to know about who you are.
Okay, well, I mean, the reality, folks, is that I'm Dr. Lane Rowling. I'm an infectious disease specialist and also a trauma surgeon. I'm on the National Black Caucus Legislature with Chairman Hardaway's my boss. And I work for him. I'm also the medical advisor for the Black AIDS Institute, which is funded by the NIH. I'm a professor of pathogen hydropathy in Germany. I'm the director of clinical and tropical medicine disease for the last 20 years, doing real world missions in the jungles, really treating Ebola, Zika, chikungunya, malaria outbreaks. I mean, actually in the field treating real people. And I'm also the chief medical officer for SRS, which is one of the top 150 minority-owned companies in the world. And we've done $1.4 billion in government contracts. I've opened up schools, churches, and, et cetera. You saw the press release today from Jack.
Yeah, I did. I shared it out.
And so that's my responsibility. Way it came and got today. We've been looking for you, Dr. Rowland. We finally got somebody that looks like you.
Yeah.
That talks like that. I've been doing my push-ups, and my responsibility is that I've done the push-ups, and what I am is what I am, and I'll tell it straight up, folks. I got 6 degrees. Dr. Fauci has 2. So you tell me background difference, and I'm only 1% of the people on the planet certified chemical and biological warfare by the U.S. Army. So that's my background. So what I'm trying to do is to save people's lives based off of science and medicine. And that's just the reality. And I want a good time tonight, celebrate your dad's life, give people the information because you have the platform. If me and Chip save one person's life tonight, we've done our job.
Yeah.
We've done our, so that's me. And so everybody knows, I speak to 1 million people a week, and, it's been exhausting, but I love it. I'm still inspired. I love going to country, Jackson, Mississippi. I love going to North Carolina and going to these schools and, talk to these little black girls and boys that have the little braids and machine and open schools for them. And so I love it. And you know what? I have no bones about it. And I'm this time, my second half of my life, I don't care what people think about me. I'm not here to qualify myself to white people, period.
Yeah. Yeah. All right. So in that case, we're going to jump on into this. Okay. Let me check and see if there are any questions yet. I don't have my cell phone beside me. Okay. All right. So we're going to jump into our questions. And so Dr. Rowling, it is happy hour and you're out on the, are you on the West Coast?
That's Las Vegas, West Coast.
Okay, you're in Vegas. Okay.
This is our talk.
Oakland Raiders.
He's saying this is bar talks. You're like Oakland Raiders. I am a Cowboys fan, but it's okay. We're not gonna talk about sports. I'm gonna get along with all of you tonight, regardless of who your sport team is.
Okay.
All right. So Dr. Roland, let me just jump in. I have some Q&A questions that I've already collected, but I do have some other questions that I spoke with another friend of mine today, and we just kind of hammered out some really good questions that we felt could be useful, right? So I've heard you talk about COVID just exhaustingly, like hear you talk and explain what COVID is, what this virus is, why it attacks the system the way it does, how it, moves through the air and all these other things. I've heard you, and a lot of people have not, but I want to get to the biggest question at hand because I noticed that today it's reported that over 200,000 deaths here in the US are COVID related. How does that make you feel knowing that I've been hearing you talk about this almost the entire year?
Well, let's be honest with it, Queenie. That number's wrong.
Okay.
125 to 250,000 Americans have died because the numbers are just fake. That's what the administration has done to keep the numbers down because it makes people panic. So the reality is that it's amazing how people back in March were talking about, well, this is the flu. 75,000 people die from the flu. No.
Yeah.
7,000 people a year die from the influenza A or B.
Right.
So we're at 225,000 people, and we haven't even got to the months of October, November, December, and January when we're going to have co-infection in the population. People are going to have not just the influenza A and B, they're going to have SARS-CoV virus, and they're going to have respiratory syncytial virus. So the death rate's going to go up tremendously. So it is astonishing. 200,000 people died. A great majority of them have been minorities, both blacks, Mexicans, Indians, Native Americans. Mm-hmm. We haven't got through the October, November, and December. So by January 1st, the number is going to be almost 500,000 people in the United States are going to die from this SARS-CoV virus mixed in with the influenza A and B. So that's why it's important that we have to educate people on the reality of what's going to happen, because this is not a hoax. This is not a game. That's just the reality. So the answer to your question is that 200,000 people, 225. We lost 3,000 something people on 9/11, and people about that. You can't read the names off for 225,000 Americans that have died or been sick and have been affected by the disease. It's astonishing.
Wow.
America. And the second wave will be here October, November, December, and January. Get ready. The 4 horsemen are riding, and they're hard.
Okay, I just want to let that sink in for a second, because I was hoping you were going to be able to give us some good news. That's not good news. That's reality.
Chairman Hardaway, we've done podcasts before.
Yeah.
You folks, the Dr. Rowling version, or I can give you the Black Mickey Mouse version.
Yeah, yeah. No, I need it real, Doc. I need it real. All right. So already I see some questions in the box. I'm
And
gonna go ahead.
if I may, that's the
Sure.
good news. The good news is you're getting the straight, no chase version of the truth.
Yeah.
Without that, the Black community cannot create, much less execute, a strategic plan to
Mhm.
fight this crisis. If
Wow.
we don't have a plan, the same way that back in the slavery days when you had the good house Negroes, they'd say Massa gets a cold, we sick Massa. When Massa gets a cold, the house Negro got the flu.
Hmm.
When America, because of the disparities in the healthcare delivery system, when America gets a cold, Black folks get the flu. So
Yeah.
when America gets the flu, we die. Okay? Unless we get this straight, no chaser truth from
Hmm.
Dr. Rowling and
Hmm.
develop a strategic plan that's based upon our community. The disparities that exist in the healthcare system exist because they don't address the situations where we live. They don't
Wow.
take into consideration the different problems that are unique in the Black community, whether
Hmm.
it's our food, our nutrition, or lack thereof, whether it's, as we talked about earlier, our housing, where we are more likely to be in multi-generational housing, also in housing that's too small for the family. Our educational levels are disproportionately less than the rest of society. So
Hmm.
we come in knowing less about how we should take care of ourselves,
Right.
knowing
Right.
less about how to research and get the information that Dr. Rowling is providing for us now. We don't know
Mhm.
where to go get it. So we
Yeah.
can't defend ourselves. We
Mhm.
can't do the work. And that's why Black folks are dying at a greater rate than the rest of America and than the rest of the world, because America is
Yeah.
dying at a greater rate than the rest of the world merely
Right. That's
because of
tough.
politics. And make
Yeah.
no bones about it, the reason that folks don't have what they need is because the leadership in Washington, D.C. was failing on the job.
Mhm.
The information was available. I got my information from my advisory task force. So when I went on the floor late January, February, I was the only one with the mask on. It's not because
Wow.
they told me out of the CDC or WHO or my state health department. It's because of the advisory committee that we had with Dr. Rowling saying this is what you can expect.
Yeah.
This is the characteristics and the behavior of the virus. So I knew to
Mhm.
have my mask when I went on the floor in the chambers of the House and with the rest of my 98 colleagues. I was the only one, everybody's snickering and
Wow.
giggling until folks started dying, until folks started going to the ICU with that COVID-19.
Yeah.
But that's
Yeah.
what we've got to do. We've got to get the information. We
Yeah.
need it as soon as we can possibly get it, develop a strategic plan, execute it
Yeah.
so we can live.
Well, that's what we're here for. So, for those of you that's just joining Bar Talks, we are talking COVID-19 with Dr. Rowland, and we have a special guest, which is Representative Hardaway. So, we're going to go straight on into our questions that someone just popped up off of YouTube. And it says, Brown Girlism is her name. Do you think the flu will be less because we are wearing masks, Dr. Rowland?
Well, that's a very good question. I know, and that goes back to the answer. To protect yourself is that this is where, like Chairman Hardaway says, is that the politics got involved in it. One of the front lines protection for you to survive over the next 2 years, make no bones about it, This is just the first cycle. Second wave will be here October, November. The third wave will be here in March. China's getting ready to do a fifth wave, and we're going to recycle back around again.
Wow.
That mask is your frontline protection. I don't care if it's an N95, 3 mask, surgical mask, cloth mask. That mask is a protection from you from the outside to the inside of the viral load infection. So is that mask is a mandatory thing to decrease your chance of getting not just the SARS-CoV virus, but also influenza A, influenza B, and also respiratory syncytial virus, RSV, and normal coronavirus that we all get, which causes a common cold. So her question is that absolutely mandatory. Your mask will be part of your clothing. It will be part of your routine. You will have the mask with the 49ers, a mask with the Raiders. Yeah. I'm going to have a mask with Hennessy Cognac. Part of our culture.
Hey, just a full disclosure. Doc is off work. It is happy hour. He's enjoying himself. That's what we're supposed to be doing right now. Okay, that's what's going on. All right. So I just want everyone to know. So if you're just joining the party, know that he is off. This is happy hour, but we are having this conversation at the bar. So here we go. So the next question is, well, you kind of answered it. It was, should we be getting a flu shot this year? I mean, because I know you was talking about, the mask is going to help to protect us, but should we be getting a flu shot this year?
My recommendation, this is based off of science and medicine. The most important shot that everybody needs to get, Chairman Hardaway, all the state legislative Congress people, Black community, the shot that is going to save your life in October, November, December, January into the future is getting the Pneumovax shot. Pneumovax 23 will prevent you from getting pneumonia.
Okay. Can you spell that?
Yes, called the Pneumonia Vax 23 shot. That, because let me explain to everybody the science. Okay. This is not a feel good, because when you get sick and you end up dying or expiring from the influenza or the SARS-CoV virus or respiratory syncytial virus, it's going to be from pneumonia. And pneumonia is a bacterial pneumonia called Streptococcus pneumonia. And that is the shot that you need to get. It's called the Pneumovax 23. You go down to Walgreens, go to CVS Pharmacy. You don't have to have a prescription. They'll give you like giving the flu, because we know that the flu shot is only 25% accurate, probably really 15% accurate. But the shot that I'm going to get, my family's going to get, my wives, my mom, everybody's going to be the Pneumovax 23.
Okay.
Kids already get it. So you can go get it yourself. That should save your life over the next 10 years in this new, not a pandemic, we're in endemic, global endemic. Wow. Disease is here to stay.
So I've never heard of that vaccine.
Pneumovax 23.
Okay.
Vax 23, CDC has it.
Okay.
You go down to your local CVS pharmacy, Walgreens, and they will give you that shot. Your insurance covers it. Okay. 23.
Okay, perfect. All right. So I will make sure that at the end of this broadcast, I actually put that up as well. So if anyone is wondering what it is, they can go out and research it once I find the correct spelling for it, but I got it. So my next question is, and just want you to know, there's someone wanting to come in the studio. If it's someone that you've allowed in, Dr. Lane, let me know, and then I'll pull them in. Okay. So the next question so Dr. Lane is gone. We'll be right back. We're gonna ask him as soon as he comes back in. So are you going to get
while we're waiting for him, let me, if I may, expound upon some of the information that he was talking about in terms of percentages.
He's back,
the
but go
odds.
Ahead.
When you're talking about your masks and the different types of masks, what's a surgical mask, a N95, KN95/KN95, or a cloth mask, Dr. Rowland will tell you that each one of those masks comes with a percentage of effectiveness. So even though you're masked up, there's no reason for you to forget that you need to be socially distancing,
Right.
that you need to be still taking precautions in terms of sanitization, that you still need to be conscious of the other efforts to keep yourself safe, keeping from contacting and thus contracting the virus, because the masks are only effective to a certain degree. So you can play the odds, and that's what you're doing. If you've got a mask and you still immerse yourself into dangerous, contagious environments. So even though you have a mask, and I do 2 masks, I do either a surgical and or the K N95 or N95, and I have a cloth mask that I will put on top of that.
Right.
So I've got 2 masks when I'm out and about, and especially when I'm doing legislative business, because each one has a different level of effectiveness. So we've got to be conscious of that. Don't think that that mask makes you Superman. Unless you're into Dr. Rowling's locker, you don't have an effective mask.
Right. I actually had to purchase.
Well, not in, like, excuse me, let me correct myself. When I say not, you don't have an effective mask, you don't have one that's effective to the degree of the type of equipment, medical equipment that Dr. Rowling or his professionals would have. Each one of these masks that I named off has a failure component to it.
Of course. Yeah, I wound up buying something that Dr. Rowling suggested, which is my little mini sprayer. And I totally meant to bring it. Yes, I have that. My son was looking at me when I was at the funeral because, people wanted to come up and hug me, and I was totally wigging out. I had my gloves on, I had all these things on. And then I got into the car and I was spraying this all around the car. And I'm like, oh my God, this is, so I have that too, Dr. Rowling. Thank you for the suggestion. And I have my jug of solution over there as well. I don't leave home without it. So the next question, Doc, is since we answered the about getting the flu shot, the next question is from Phyllis Bratchard, who is in North Carolina. Dr. Rowland, if you've already taken, or if you haven't taken the flu shot in over 20 years, you should suggest taking it now?
Oh, absolutely not, because the flu shot is only 25% accurate. It might be 15% accurate.
Okay.
If somebody had a 15% grade flunky, would you want them operating on anybody in your family?
Wow.
That's an F. So the flu shot, people have to realize it's not effective, because the virus itself, the influenza virus, just changes all the time.
Okay.
Recommendation. This is Dr. Rowland's recommendation, and I'm the global guy in the jungles of Peru. I've dealt with influenza. Vax 23.
Okay.
That is a game changer for Black Americans.
Okay.
Start talking about, and I think Chairman Hardaway's going to talk about, when they start talking about vaccinations and shots. Oh, all you Black folks out there, I already know what's going to happen, because you can't get tested. But when they about to do this shot, they can give all you Black folks some grits.
I got my question about that here as well. So I'm going to get to that so we can talk about the vaccine.
Bus, give y'all some grits and some Subway sandwiches, like Chairman Hardaway say, that plantation Negro stuff. And they're going to inject y'all with that vaccine, and it ain't going to work. And y'all going to find out what's going to happen. Because I'm gonna drink my vodka and orange juice back.
Throw the whole microphone away. Okay. All right, let's move on. So from Gina, so basically the answer to that is no. You wouldn't suggest getting the flu vaccine now.
Pneumovax.
Instead, do the Pneumovax. So Pneumovax is your recommendation for this season from here on. Okay, so do you recommend no air travel for? So do you recommend no air travel for the next 2 years?
I'm traveling almost 3 or 4 times a month everywhere. I'm talking about to Jackson, Mississippi, North Carolina, Chicago, California. I'm opening up schools. I'm protecting, New York City, the massive transit authority. We travel. But when Dr. Rowland gets on the airplane, I have my 3M Darth Vader mask because I know there is no such thing as social distancing on a plane. So that type of mask I wear. So traveling, you can fly everywhere. In fact, my brother just is getting back from Brazil tomorrow.
Well,
I'm heading back to Germany because we know what the bio safety and security protocols are.
Okay. And I didn't get a chance to read your bio publicly or on the air, but I definitely want to do that because I need people to understand where you're coming from, your experience from being a service member and working overseas in several different countries, fighting infectious disease.
Come on, girl. If Dr. Rowland can drink vodka, that's all y'all should be drinking.
Right. All right. Okay. So this is chocolate wine, just so you know. All right. So we're gonna go to the next question. Gina S says that she had the Pneumovax 23 in 2018. Do I need a booster? And she says that her doctor won't provide one.
No, because the vaccine lasts anywhere from 3 to 5 years. She's fine.
Okay.
Now, when you got doctors in this business, and I don't know what her doctor is, but I'm going to throw out numbers because we hear. I mean, this is happy hour.
Yeah, it is.
Part 2, Dr. Chairman Hardaway, you got to bring your favorite wine glass.
Yeah, you got to come back. Yeah, you got to bring it because we're going to do just part 1. We're definitely going to do a part 2.
Yeah, but here's the deal, guys, and this is the reality. When Chairman Hardaway came and recruited me to be on the Black COVID Healthcare National Task Force for the Black state legislators throughout America, I had to tell the truth. He told me. He said, Chairman Hardaway said, I said, Chairman Hardaway, I'm a military guy. I said, hey, I got your back, Chairman Hardaway. Chairman Hardaway said, I said, you got my back, my 6? Chairman Hardaway says, Dr. Rowland, I got your back with some juice. I love that. But what I'm telling you folks is that this is game changing. You have to protect yourself and be ready.
Yeah.
Pneumovax shot.
Okay.
Out here where we're going. Hey, let me finish up what I'm saying because this is important. It was in the paper just 2 weeks ago. Journal of Medicine. It was in the England paper. Black babies that are taken care of by white doctors have a 3 times more likely rate to die. Let me repeat this again.
Wow.
Black babies that are taken care of by white doctors have a what, Queenie?
3
times more likely to
die. Wow.
So imagine if that number is true, white doctors don't care about black babies. You can number is for black folks that are older.
Wow. That's I'll let that sink in for a second.
Repeat what I said to everybody out there.
That's 3 times more likely to die. Black babies that are taken care of by white doctors.
So what does that take?
It makes us wonder why that is. And if you think about that, then look at our elderly population as well.
You think they really care about some 58-year-old black grandmother who likes grits and collard greens, some white doctor from Beverly Hills? You think what they've done to our people for 400 years, they consider us animals. We can talk about the Tuskegee syphilis experiment. Yeah. We can talk about all the stuff, the horrific stuff they've done to us. We're animals to them. Mm-hmm. So why would you think that they have any cariness for our babies, our black babies?
Yeah.
This is not me. This is
Right. Wow. That's something to really think about. Okay, so let's move on to the next question, and I still have tons right here for you. Insightful 1234 says, "Good evening, Doc. The Pneumovax shot, is it 2-part? I have had one 5 years ago. Do I need another?"
Yes, you do. Now, my recommendation: you've already had the part 1. Make sure you get the Pneumovax 23 shot, and you need to get that at least by the 2nd week in October.
Okay.
To build up your immunity and stuff. Folks, let me tell you something. I could recommend when people start talking about treatment, they start talking about vaccination. I'm going to tell you Pneumovax 23.
Okay.
Changer. for
I'll
Black.
make sure I put that. I'll make sure I put that in our sections, so everyone can read that in the description. Okay, Patricia White. She says, my sister had COVID horribly and survived. She did have pneumovax, but still had bilateral pneumonia with COVID. Can you explain the logic there?
Because guess what? When you get a pneumonia, the pneumonia can be either viral or bacteria.
Mm-hmm.
The bacterial pneumonia we treat all the time. You can get the pneumovax 23 that will prevent you from getting the bacterial pneumonia, which more likely is going to kill you of anybody. Viral pneumonia there's treatment for it, which is a lot less. And so the problem is that when you get these diseases, SARS-CoV virus, influenza, you can get both bacterial and viral pneumonia. But let me tell you, I've taken care of some of the most important people in America because I'm the go-to guy.
Mm-hmm.
Biggest problem that people need to realize, and I think I'm going to let Chairman Hardaway talk about this, is the rehabilitation cost. If you survive the amount, fog of the brain, trying to get back, 25% loss in respiration, respiratory, fatigue. Chairman Hardaway, tell them about the cost on that, the rehabilitation if you survive.
Well, it's tremendous, and you talk about a cost that could be with you for a lifetime, and you're talking about a people who we have a great number of folks just here in Tennessee. The projections are in the millions who don't have suitable health care coverage. So who's going to pick up those costs? You are. And what's going to happen to you when you can't pay them? Then you're talking about financial stress. You're talking about the added psychological, mental, emotional stresses that go with the financial stress. You're talking about the inability to move ahead economically, whether it's buying a house or whether it's putting your children through school. That's why the Tennessee Black Caucus has come up. I spoke to it earlier with 6 ways to frame the different crises which are generated by the COVID-19 crisis, that we have an economic crisis, that we have an educational crisis, we have a housing crisis, we've got a crisis directly related to criminal and civil justice, individuals being put out of their homes, but they can't go to work either because they don't have a job or they don't have care for their children, or they themselves have tested positive, have to stay home and quarantine. There's just so much going on now that I'm back to what I said at first. Black folks have got to get themselves educated, and then Black folks have to develop their own strategic plan, and Black folks have to execute it. Nobody is going to save us but us. If your leadership isn't talking about the things that I'm talking about with you now, you got the wrong leadership. You need to change leadership, or you need to prod them to get off that pot and get busy looking after the community. But Dr. Rawlings is correct that there's so many things that are going to cause you pain and agony and stress and distress for the rest of your life in some instances, even after you've fairly recovered from the disease itself.
Right.
And the fact that we don't know everything yet. We don't know what the damage is to your brain. We don't know what the damage is to your kidney, your liver, to your heart. We know how extensive it is to your lungs. But there are other things that are going on in your body as a result of the disease that we're still trying to document and develop that body of study. So it's playing out in so many different ways. Those members of the community who don't even know they've had it, that doesn't mean you're not going to develop some of those conditions down the road. You might have them now. They'll merely become more acute as you age or as time goes by. So this is not a joke. When you hear numbers, when you hear DC, the president in particular, trying to mislead you into thinking that there's nothing going on, nothing to see here. He's lying. Okay. I say that with all sincerity. He's lying to you. When you've got a president that stands on stage, encourages everybody in the audience to show up without a mask and to boo anyone that talks about wearing a mask, and yet you can't get close to him because you don't have a mask on. Now, you don't think about that, but all those folks that he keeps yards away from him, they can't get close to him. That's why he doesn't mind having a mask on, because he does not have to get close to you. He's observing the same protocols that he's telling you to ignore. Everyone that comes close to him has to be tested, or you can't come close to him. But he's telling you it's okay. Run out and hug each other and kiss and yell in each other's faces, and don't worry about wearing a mask. You're killing yourselves. You're killing your neighbors. You're killing your friends. Don't listen to that foolishness.
Yeah, it's so misleading. So misleading. So Dr. Rowling, we have two people that are trying to get in studio. Harris is one last name. Suber is another last name. Do you want me to allow them in at any point?
Oh, you're talking about B. Harris, the famous editor of magazine. Michelle Obama, Barack Obama, Joyce Reed. Girl,
you know, I want to make sure it's a safe space for you. and Charlotte Suber.
You better put so, hey, I got my refill.
Welcome to Bar Talks, the podcast. I'm sorry, I had to vet both of you before I allowed you in. I'm sorry. He didn't give me a heads up. I had to vet. I apologize for you having to wait so long. But welcome to the podcast.
Thank you. I'm glad to be here.
Thank you for coming. Okay, so I want to get through these two questions that's on screen right now from the viewers, and then we'll keep moving along. Okay, and of course you can introduce your new guest. So Doc from Wanda Maps, she said, "Good evening. What was the mist that Dr. Rollins was spraying, and where do you get it? And do you recommend the face shield or mask for greater protection?"
Okay, I want everybody to take a pen and paper out there, your whole entire audience, because part one. This is part two because hey, I got my refill.
Yeah.
So I got good to go. This is part. Y'all can do next time we do this, y'all can do wine. I'm gonna stick with the real stuff.
That's okay. But we'll have another happy hour.
But I want everybody to understand, it's very important that you need to understand how diseases are transmitted. We have 6 F's. We have 1 R. F's: feces, flies, food, face, foot, formite, and fingers. And R is respiratory. If my general audience out there understand how diseases are transmitted, then you can protect yourself. Very, very important in understanding the transmission of diseases. Your audience needs to know that I've said this for 6 months, that this virus can stay in the air for 14 minutes. It can go a mile. It can go 3 feet, 6 feet. But folks, one of the biggest transmitters of this disease is fecal contamination. Your bathroom. Somebody can be asymptomatic. Somebody can be positive. They flush that toilet, that virus becomes aerosolized in the feces and it spreads all over your bathroom. The virus can last in feces for 35 days and be alive. Wow. You go in the bathroom, you step on it, it gets on the bottom of your shoes, you can transmit the diseases 150%.
Wow. Okay. All right. So the next question is, I hope everyone heard that. Feces, flies, food, face.
We got flies.
Yes.
Fingers. Feces. Food. Formite. Foot. Face. And the R is respiratory.
Yes. That is scary when you say the food, and it makes me want to ask the question about how us going out to eat right now.
Let me explain something. This is how powerful, guys. This SARS-CoV virus has changed the way we live. You are not going to back what it was 6 months ago, a year ago. We are finding the SARS-CoV virus in frozen chicken wings, hamburger meat, pork plants, frozen on the inside in the meat and also on the package.
Wow.
That is why it's very important that when you get packages, you better be spraying it and disinfecting with ProGuardian.
Yeah.
You better make sure you cook them chicken wings well done. Folks, this virus has changed our society 150%. B. Harris, famous editor. Why did you put me on the cover of your magazine out of Denver?
I don't have B's video.
Oh,
but I do have audio.
Oh, well, I'm going to introduce myself. I've been publishing the Denver Urban Spectrum for 34 years, and I'm at deadline right now working on our big, it's a political issue. We're a monthly publication. So, but I put Dr. Rowland on there because I was very impressed with everything that I saw and heard and read about him. And I follow him. I wasn't expecting, I usually just get on whenever he's speaking somewhere. So I wasn't expecting him to talk, but I welcome the opportunity because every time he talks, I learn a little bit more.
Yeah.
I use my ProGuardian. When you were saying that you were using it, you use it in your car. I do the same thing. But when people come to my place, I got a friend. When he comes by, he holds it. He puts his arms up like he's. I think I'm in jail. I'm going to jail. He holds his arm up just like the
yes, like this.
And that's the drill. When they come in, they take off their shoes. But everyone does that. But the ProGuardian, I believe in it. I have a lot of it, and I'm going to get more. And I think everyone's got to have it. It's just a protection. I went to an event this weekend. The NAACP, they were having a drive, and I'm there as the Urban Spectrum. I'm promoting some fun stuff that they had provided with us. Movie T-shirts and movie hats for All In. That was the movie with Stacey Abrams, and then also with the Antebellum. But of course, I had my August issues with Dr. Rowland on the cover as well, and some ProGuardian sitting there. So I don't want to miss the opportunity because it's critical. It's critical, and everything that he says and everything that everyone feels about what the president is doing and how you can't touch him. We only can save ourselves.
Yeah.
We only can save ourselves. So I appreciate the opportunity and have a couple of minutes to talk and listen to Dr. Rowland. Like I said, I learn something new every time.
Every time.
Yeah, every time. But I'm gonna get my Pneumovax shot, because I have never taken a flu shot as well, and I will not be taking one this year or any other time. But he's the real deal. Yeah. That's all I have to say. He's the real deal.
Yeah. Well, thank you. Thank you again for joining us. So Doc, do you want to finish the last part of that question or the first part of the question? Wanda Maps from North Carolina asked, what was the mist that you were spraying? So we know it's ProGuardian, and she wants to know, where can we get that mist? I know I have it. Of course, I can leave the information there, but you want to share?
Yeah, I want everybody to understand that as a medical science, as a biological warfare expert, the why I have survived for 30 years dealing with some of the most pathogenic viruses, bacteria on the planet that could kill you in 6 hours. The reason why we have the best technology, one of the best technology that we have vetted is ProGuardian. And this is hypochlorous acid solution. This is what I'm spraying. This has been around since 1858. It kills not just the SARS-CoV virus, it kills Ebola, influenza A and B, E. coli, bacteria, MRSA, Pseudomonas. Natural organic product, not like chlorine, because you keep using chlorine, you can get lung cancer. It's not Lysol, which is a pesticide. We use this in our so ProGuardian. You can get that as SRS, www.srsproducts.com.
Yeah.
PRODUTS.com. Let me repeat that again. www.srsproduts.com. ts.com. This is the game changer. And you guys know I put these biodecontamination units in hospitals. Cost $45,000, $50,000 already running. We brought it down to what we call the PPD, personal protection disinfectant mini bios that you can take on the airplane. The kids can put them in their backpacks. They can spray your dollar bill, ATM. They can spray their books. You know what? You're using it right now, Queenie.
I'm using it.
Tell everybody how you're using it.
Yeah, I use it. I used it on all of the obituaries that I received yesterday. So when they handed them to me, I immediately sprayed them. I spray my car. I spray my clothing because people were hugging me and I didn't want them to, and they just kind of come and give me a quick hug. And I'm like, I'm spraying them. I know they thought I was totally losing it, but again, I too, like Ms. Harris said, I believe in it. And so I just need to keep my space clean. I mean, I did ask for 6 to 9 feet, and it's difficult sometimes for people to understand that that's what you want, even, in mourning. So I just used it. I sprayed my son down, my car, everything in my car. And all of my mail, everything that comes in from Amazon, I now spray it.
You have to do that, folks, because folks, let me tell you, fecal contamination is probably the biggest transmitter. It is that virus can be on a box from Amazon.
Wow.
It can be on your frozen chicken wings that they get up in Idaho instead of Memphis, Tennessee. You have to think that this virus is outside of packages because the chicken plants, the meat plants, and the pork plants are infected. People are coughing. Just because you freeze a virus doesn't mean it's dead.
Right.
The virus is asleep. Hey, you know what? Let me take another drink. And who's the next guest down there?
Okay. The next guest. Well, let's see. We have another question. Hold up. We have another question. Okay. So someone is saying, where can you purchase the spray? So we already covered that. Do you suggest the Pneumovax vaccine for elders over 90 years old? And someone said, no way, I'm getting the vaccine. I'll let others enjoy it. So do you suggest it for anyone over 90?
My recommendation is that Pneumovax, I don't care if you're a year old up to, you can be 120 years old. Mm-hmm. The game-changing technology based off of science and medicine, the Pneumovax 23 is going to save your life.
Okay. All right. So there you have it. All right. Now, the next guest. She just moved. Charlotte Suber. Am I pronouncing that correctly? Hi.
Yes, it's Charlotte and Larry Suber. Larry's here, Dr. Rowland. Well, say Doc.
Okay. So we are live. Just so you know, we're live on Facebook and we're live on YouTube. Share the video, put it out there, let others join us. And welcome to the Bar Talks podcast.
Thank you. Oh, thank you. I'm sorry. Thank you.
You guys want to say anything or what? Y'all scared, man? Y'all scared?
No, we ain't scared. She came and got me for downstairs. I didn't even know she was on. I knew it was going on, but I kind of forgot I was on another call. But yeah, Doc, I want to ask you a question because I remember you talking about taking the flu shot versus and the pneumonia 23. Well, I went to get the pneumonia 23, and when I had to get the nurse to make an appointment, and my doctor said he didn't recommend it because I wasn't 65 years old. And I'm saying that has nothing to do with why I'm taking this. He said, well, you need to be 60 or 65 with some underlying things going on with your health, So I told him I was gonna get back with him. I told him I need to talk to Dr. Rowland.
Well, my recommendation is that I don't care what your doctor says, and like we talked about earlier, we know that when it comes to black babies taken care of by white doctors, you're 3 times likely more rate of dying of the babies taken care of by white doctors. You can imagine them looking at you, black man you probably got some Afro hair. They probably food that you eat. You better go find yourself a doctor that's going to give you that Pneumovax 23, and don't be talking about playing around. I guarantee you, he probably got the shot.
Wow.
You can still get it.
Yeah.
All right. So y'all heard that, right?
Yeah.
Okay.
Yeah.
If I may,
Sure.
We've done a number of studies here in the state of Tennessee on infant mortality and maternal mortality rates. And what Doc is saying is on point. And what seems to be part of the issue is, are the doctors listening to the patient? Are they taking the patient's concerns seriously, especially Black women? Are they taking the time to spend with that patient that they would with a person who is non-Black? Are they taking the time to run the extra test, give the extra counsel, have that conversation with the patient about care? So whether it's a conscious effort or whether it's just incompetence, the results are the same. You've got a better chance of dying, depending upon what the issue is, in going to a doctor of color versus a white doctor.
Okay.
For whatever the reasoning is, there's a lot of correlations. We're still trying to determine the causations.
Right. Okay.
Awesome. Awesome, Chairman Queenie.
Yes.
This is real.
Yeah, it is. It is. It is. All right. So I'm going to go back to our comment box. So
Let me be very clear on this. If you're a Black woman, find you a Black woman as a OBGYN.
I do have a female doctor, a Black female doctor, actually. So the next statement is, or question, Gina S. said, what should people do if their employer requires a vaccine for continued employment? I'm not sure which vaccine she's referring to. I'm assuming maybe the upcoming vaccines for COVID. So we can maybe skip that and come right back to it, because I do have those questions as well.
That question, because,
Okay.
part one, we have to keep it real, because everybody keeps talking about the supposed to be magical vaccination. Folks, let me tell you the truth. The vaccination is not going to work. Why? Because this virus, the SARS-CoV virus, has already had 12,000 mutations. It mutates every 2 weeks. That's fact. So you cannot have a shot that has so many different mutations. HIV, no shot. Ebola, no vaccination. So that's the reality of what we're going with the science and medicine. That is fact. That's why you have to have great biosafety and biosecurity protocols to protect yourself, i.e. hand washing, frontline, mask, ProGuardian, understanding the environment. So I just want to just make sure people very clearly, there's not going to be no magical bullet, folks. And what I want to talk about is that, remember the Tuskegee syphilis experiment. Boy, they injected Black people like cattle. The state of Alabama is making $1 billion a year off the backs of the cerebral spinal fluid of Black folks, period. Second, Operation Warp Speed, 1952, polio. Man, they injected a lot of people. 20,000 kids in America died or were in iron lungs. Operation Warp Speed, 1972, swine flu. You can die. Hey, Operation Warp Speed, human papillomavirus vaccination. Women getting paralyzed, Guillain-Barré syndrome. Be careful. If I get the injection, you get the injection. I'm going to stay on. My family's going to be on the back of the bus on this vaccination.
Okay. All right. So yeah. So Gina S. Thank you for that, Dr. Rollins. Gina S. was actually referring to that particular vaccine. So the next question is, or the next statement, Patricia White says insurance will only tend to cover Pneumovax over a certain age. I think 65 or above. Unless there's an underlying diagnosis. But she did also say that the vaccine, if you self-pay, is between $200 and $250. So those of you,
it's your life worth. You can go down. I mean, maybe some insurance is going to cover.
Yeah.
But tell people, you can go down to CVS pharmacy and get the shot right now. You don't have to have permission. You can go to Walgreens. Is your life worth $250? You got to pay out of pocket? Yes or no?
That's fair. That's a fair question. Okay, so the next question is in our Q&A. So this is kind of an interesting question for those that are attending to date this season. The question is for Dr. Rowland. It says, so since it's cuffing season, I hope y'all know what that means. is a body condom necessary for dating in the future? I mean, you can answer that any way that you want.
Hey, I got Chairman Hardaway on there, Chairman of the Black Congressional Caucus, COVID Healthcare Task Force. I got the Reverend Severn, his wife there.
Yeah.
Joe Sunday with the Black Reverends in Georgia. What came first? I always tell you, if you really love a woman, what you do is you give her strawberries first before you give her the chocolate. But here's the reality, folks. This disease, we find the virus also in semen. Is there there will be transmitted part of the disease. Also, the virus can transmit itself across the placenta. If females are pregnant, they can transmit disease to babies. That's a fact, just like Zika. So my recommendation over at least the next year, if you're not totally in love, you better be wearing a condom or protect yourself, because we still don't know what the results are going to be to the children.
Right.
Neurogenous defects,
right,
birth defects. So my recommendation, if you're going to deal with chocolate and strawberry, you better be wearing a glove.
You know, I don't even understand how people can become intimate. I mean, because you're breathing in the same air. And I think I heard somewhere on one of the news channels, one of the people that was speaking suggested that you wear a mask while making out. I mean, this sounds crazy, right? But
Chairman Hardaway, this is happy hour, right?
This is happy hour.
Yes, sir, it is.
So,
no mask. I got to breathe.
Yeah, if you're wearing a mask and you're being intimate, you probably with the wrong person. That's simple.
I mean, no, the real talk. I mean, should people go and get a COVID test before? Look, I'm just a host.
Okay, so you're telling me that you can see two Darth Vader people wearing masks, right?
Doc, I don't know. That's why we're asking these questions. No question is a dumb question now. What do you suggest?
Oh, I love you.
So let me tell you what I tell the women especially about diseases and lovemaking. Okay.
Oh God.
And this has started. I hold conferences every year, December, World AIDS Month, and I want Black women in particular, because the rate of infection in Black women of childbearing age is absolutely off the chart.
Right.
And the reason they're getting the infection is because of heterosexual relationships. That means mostly Black men are giving Black women these diseases. So I keep it real simple. Just say no, N-O, until you know, K-N-O-W.
Nice.
Just say no, N-O, until you know, K-N-O-W. And you can't know unless you and your partner are going to get a test at the same time and you pick up the results together.
Right.
That goes for, and that should be standard if you're having a relationship with anyone these days.
Okay.
You need to know, K-N-O-W. Just say no, N-O, until you know, K-N-O-W. Can't make it any simpler, any plainer, can I, Doc?
Chairman Hardaway, I support you, but this is happy hour. I ain't wearing no Darth Vader mask when I'm getting down. I got to breathe.
I'm sorry. Throw the whole podcast away.
This is bar talk, right?
This is bar talk. With the bar. All right. So Doc, Patricia Jones Blessman said that hookups and booty calls are officially out.
Well, hey, I tell you right now, with my wife, I'm still rock and rolling.
Okay, I get it. I mean, that's a safe space, but I guess those that are single and out here trying to date, it's difficult. It's very, very challenging. And although we're laughing and making light of it, it is a real serious issue amongst those of us that are single and trying to figure out this whole dating thing when you do not live with your partner.
Well, hey, Queen Love, whoever the guy ends up rocking your world, his name might be Benny. You make sure you talk to me so I can tell him goodbye, big roll. John.
I'll check in with you first, Doc. Check in with you first. All right, we're moving to the next question. Oh my God. Oh Lord. Okay. How can we remain safe, especially during the flu and cold season? We've already covered that one. What are your thoughts on family gatherings over the holidays?
Well, that's a very good question. But once again, you can do that if you have great biosafety and security protocols, i.e., you're making sure people wash their hands, not with soap and water, but with great desanitizer hand, also great antiseptic hand wash. Making sure that your family members that come in there, they understand the utilization of masks. They need to make sure they have ProGuardium spraying themselves from the top of the head to the bottom of their shoes, making sure they don't wear their shoes inside your house because the shoe is a vector, it can transmit that virus. Making sure you understand that social distancing, 6 feet, 9 feet. Hey, folks, if you have a mask on, you got some protection. If you understand these biosafety and biosecurity protocols, you're not going to have a problem. But if you're going to be like Herman Cain, talking about you Superman, you don't need a mask. You're going to be with heaven. So make sure you have practical sense.
Yeah.
If you have barbecue, make sure your packages are sprayed down with ProGuardium. If you like chicken wings, make sure the chicken wings are cooked well. I don't know any black folks that like cold grits. We like hot.
What y'all don't know is we've been talking about grits since Dr. Rowland came on. Before we ever started recording, he has been talking about grits.
But to your answer, Queenie, you can have a family gathering as long as you protect yourself. You can't take your mask off. If you got people in your house and they're using your bathroom, you need to make sure that people are flushing that toilet, putting the lid down, make sure they have great surface disinfectant because we know people are nasty. I mean, they go in there, they take a dump. I've seen rich hotels, they take a dump, they don't wash their hands, they touch the door handle, the rail. So you have to protect yourself and have good common sense, folks.
Right. Okay, so here's what, and I'll add this. I was supposed to have been going to my hometown for Thanksgiving, and typically this is what we do. We have these really big fun gatherings, and I have two switches that's on and off, and it's difficult for me to get into large groups because I'm such an affectionate, loving, kind of all over the place person. So I just don't go at all. So I'm fully isolated. And so I told my family, I said, well, I'm willing to come if we all get tested a few days prior to, and we still wear our mask and, do everything that we need to do to stay safe. But I just want to feel okay coming to the event. Well, that did not go over well.
I can tell you right now, I'm gonna feel good to Thanksgiving because I'm gonna have some cornbread stuffing. I'm gonna have me some potato salad. I'm gonna have me some cranberry sauce and some turkeys. I'm damn sure gonna have some sweet potato pie.
But listen, so I don't think I'm going anywhere. But do you think? I mean, is it unrealistic for me to request that from a family of, let's say, 20 people, that we get tested prior to us coming together? And I mean,
depending on what test you have, because the test, there's only one specific test that I recommend.
Okay.
That's PCR test, polymerase chain reaction, which is the most sensitive test that we use to diagnose disease. 100% accurate.
Say it one more time. Say the name of it again.
PCR technology.
Okay, yeah.
Not antibody, not antigen, PCR. If they can get that, that's fine. But I'm telling you, folks, because we've opened up schools. You can go to get that. I'm going to get me some turkey. I don't know about you. You might be eating some wrong.
I'm vegan.
Stuff.
I'm vegan. I'm eating my greens. All right. Okay. So I'll rethink the trip. I mean, I did go to the funeral, and it was very, very hard for me. But
hey, Queenie, do me a favor, because we're having this is a bar talk. Please, for me, because I've been in that world as a doctor for 30 years. I put a lot of people in body bags, and people died in my career from diseases.
Mhm.
Tell everybody right now about what you've experienced in the last 48 hours and what you experienced over the last week, because it's important for people to understand the reality of this. This is
Yeah.
not Fox News.
Yeah, yeah. So for those of you that are new to the podcast, as I shared earlier, I just buried my father on yesterday, and he died from complications due to COVID. And so it was the hardest thing I've had to do because he was my best friend. But hearing that he was diagnosed because he had gone to a rehabilitation center, I was devastated. And I was angry because when he had gone to the rehabilitation center, he was negative, and I never wanted him in there. So from day two, I kept, talking to my other family members. I want him out. Let's get him out. Let's get him out. Let's get him out. But I think one, due to not understanding the, I guess, the ramifications of being in such an environment when you really don't have to. I think what you not understanding that you kind of feel comfortable with your loved one going, thinking that they're going to be okay. But in truth, that he wasn't okay. I learned a lot about that particular facility, how they managed their patients. They're going in and out. How the patients were not tended to properly. They didn't see, he just experienced a lot that he just did not have to experience when he only had a fractured hand. That's what he was there for. So he was there for rehabbing for his fractured hand.
So your father, I want everybody to understand that her father went into a rehabilitation center for a fractured wrist.
Yes.
And ended up dying from the COVID-19 disease.
Yeah.
That's
yeah. And literally he was diagnosed on a Friday, and he died 2 weeks later on September the 11th on a Friday to the date, almost to the moment. And as I was sharing earlier, you had fallen off, Dr. Rowland, like really listening to, every day we kind of Zoom called in and out with the doctors and the nurses, but hearing him really talk about his lungs and the devastation that was happening to his lungs, it was so traumatic for me. And so I still have this image in my head of how this disease or virus, like I say, solidify or seems to cement in the lungs. And I just kept thinking about my dad and how he struggled to breathe. And so he went from the oxygen mask to the tube, and that was it. He never came off of that. And so, and it was such a short period of time. And I don't want any, I think for me, I hope that anyone that's listening, if they have anyone that's elderly, if you can avoid sending them to any facility, then, and I mean, like something as simple as rehabbing, let them stay home with you. I mean, help them that way. Figure out how you can control that environment, because we didn't do that for my dad. And I do believe that if we had done that, then he would still be here. And so that's the reason why this conversation is so important to me. And it's so important for me to get this information out, not just for myself, but also for my family, because I want all of us to take it more serious and to really, really understand just how contagious it is. Like, it is just that contagious, right? He was negative. And then suddenly here we are having to bury him on yesterday. So, yeah. Woo, Dr. Rowling. Okay.
well,
Again.
Hey, this is Dr. Rowling. I'm not
Yeah.
here, like Chairman Hart said, I'm not here to be your butt. I'm here to tell you the truth. I can give you the black Mickey Mouse and the black Peter Pan, but I can tell like because that's
it's serious. It really is. And I just hope people take it, just stop thinking that, it's, like it's a conspiracy theory, and it's none of that. And that brings me to my next question. The myth, Dr. Rowland, I know you've heard it all, especially when you're not in your, hold on one second. So, Charlotte, could you please mute? Because I hear some, could you mute? Just thank you. So Dr. Rowland, I know you've heard several myths, and especially within our community and others, but could you tell me the myth that bothers you the most about COVID-19?
I think for me, the myth is just the stupidity of people trying to take a virus and politicize it. Viruses do not recognize borders, except I've heard this. Who was this white chick running around back in March? Is Moscovich? Where's she at today?
Yeah.
He was a footnote in history. That you don't wear a mask, and the walking on the sand, and the voodoo black doctor down in Texas talking about sperm from the demon.
Wow. Yes.
To give these people from? I mean, it's just, I've never seen these people in the jungles of Peru with me down the Amazon. Mm-hmm. I've never seen them guys holding a dead baby that died from a disease, and a mother's crying, talking about Dr. Rowland, Why is my baby dead?
Mm-hmm.
The biggest thing for me is the foolishness of people. I am not like Chairman Hardaway. I'm not a politician, activist, socialist, civil rights leader. I'm not you, Queenie Love.
Mm-hmm.
You know, I'm drinking a vodka and orange juice. I'm like this, pasture, God and stuff. But I'm in my lane when it comes to infectious diseases.
Yeah.
You're not going to tell me anything about infectious diseases unless you have my 6 degrees. I've never seen you in Fort Detrick, Maryland. You don't have a top secret clearance I have. You've never been in the jungles. Shut up.
Mm-hmm.
Stay in your lane.
Yeah.
My biggest problem is that you got guys out there that are accountants. All of a sudden, they're virologists. That's the problem.
Wow. Wow. Anyone want to add anything? Charlotte, I know you both were unmuted for a second. Did you want to add something?
Yeah, this is her husband, Pastor Larry, and
Okay.
and I want to say that everything you guys are talking about is so important, and so much of the knowledge that I received from Dr. Lane Rowland. I talked to doctors, I talked to specialists, and a lot of things that I've been hearing from him for maybe 6 or 7 months, they don't have a clue what I'm talking about.
Yeah.
Even when I went to the doctor's office the other day and I told him that he was, I hope I'm pronouncing this right, a virologist.
Yeah.
Am I saying that right? And they looked at me like they didn't have a clue what I was talking about. Now, in the Black community, I'm always doing different teachings, and I'm talking to different people, and I pass on the information because I believe in human. I'm a humanist, and just like Doc says, and he believes in helping people.
Mm-hmm.
Well, the biggest part of what goes on in the Black community is that they believe that they're untouchable. And they believe because my family is having a big cookout with 100 people, it's okay because we're blood.
Come on now.
The information that I pass on, the information that I pass on, they look at me as if I'm strange. I had a cousin that was murdered, and I know there were 50 people at his mother's house at the cookout. There was one person with a mask on, and that was me. And somebody even went live, and I didn't know it until later. And it was like, look, Pastor Larry, he's the only one out here with a mask on. You got that right, baby. Because just like Dr. Rowland, I'm a man of God, I'm a pastor, but I'm not going to go along just to get along. I'm not going to play that game. Me and my wife are very serious about our health, about the welfare of our health, and understanding what we're supposed to know. Because just like I'm not going to preach, but just like the Bible says, my people are destroyed for lack of knowledge. So many don't have this knowledge. Even when I went to the doctor's office and I was telling them the things and they were looking at me like, wow, who is this guy? But the information that I received, I got it from Dr. Rowland. So I take my hat off to Dr. Rowland, to you guys. And we got to continue to be that example. I can care less how somebody looks at me because I got a mask on, because I got gloves on, because I'm spraying the bottom of my shoes every time I get in and out the car because I leave my shoes at the door. My neighbors across the street are looking at our shoes over there. I saw them one day and they was looking like, why are you leaving your shoes outside? You know what I mean? So we got to make sure that we stand on what we learn, what we know, and pass that information on to our people. And just like you said, and my prayers and condolences to you and your family about your father. But we got to set an example because so many think that they're untouchable. They think they're Superman. Superman even had a weakness, and that was kryptonite. So Black people, if you're watching this, I'm going to share this. I'm going to put this out here to every group, every people that I know, that we got to pay attention because we are more at risk.
Yes. You know what? You better go ahead. Look, I'm ready to raise an offering for you. That's true. That is exactly, there's some feedback I'm getting somewhere. If we could just mute for a second, we can figure out where that's coming from. But that was one of the reasons why I want to do this, because I want to make sure that people that look like you and I are hearing this, are really getting the information. And Dr. Rowland, he's putting it out there. And I don't think enough people know him. Enough people haven't heard him. We need to get celebrities on board to hear him and to keep pushing this, so that, because their reach is much farther than mine. But if you share, then other people share, we can continue to pump this information out. Real talk for people of color, but all can learn. So thank you guys for joining me again. Dr. Rowland, I'm going to go to the chat box. She says, okay, I see Dr. Rowland, he's in and out. Okay, so I'm sure he's going to come back in, but we'll go ahead and read this. Patricia, thank you so much for your kind words. Thank you so much. So based on what Patricia has learned from Dr. Rowland, she said she has consulted and written biosafety protocols for family gatherings and a couple of weddings. No one has gotten sick. There are ways to do it. Patricia, I would love to get that information from you, because I definitely would love to be able to share that with my family, because that's one of the reasons why I'm thinking I'm not going to actually go down south, although I really want to see my family. So if you could send me that via email, or if you can, and my email is I'll put it in the chat, actually. It's bartalks 2.0 at Gmail. So you can send that to me, and I will definitely share it for others, or if there's a way I can get it from you. maybe if I have to purchase it, I don't know, but just let me know, because I definitely would love to have that. So we'll do that now.
And Queen, if I may, that's an example of what our culture has to do. We have to refine the way that we go about business. What used to define Black folks, we've got to do some tweaking. There are the same way that she's talking about writing it down, so everyone will pay attention to it, be able to have that check off list of do's and don'ts. That's going to save lives. So we can still do some of the things that we like to do, because we Black folk, we believe in family, we believe in gatherings, but there's a safer way to do it. To be completely safe, don't do it. There is a safer way of doing it, where you lower the risk factor. So that's what Black folks have got to understand. We are going to save ourselves. This is a case, my dad and granddad used to talk about that stupid tax that you have to pay for being stupid. In this case, it can cost you your life, it can cost you your health, but there is that stupid tax, and what you don't know can kill you. Or it can cause you to have bodily injuries that will be with you for the rest of your life. And sometimes they may not become obvious until later on in life. And I'm telling you, if y'all don't get to the polls and vote, you're not going to have health care to be able to pay for these injuries that you're going to have, because COVID-19 and the results of the disease itself will be labeled as a precondition. And if the current president has his way in the courts, or if he's able to have his way with a Congress that is of his party next year, he's going to do away with it, and you won't have anything to replace it, and you'll be paying that stupid tax. So Black folks, take care of yourself. Learn the protocols that will allow you to practice good, safe health, and still be able to healthcare, and still be able to gather and have your family outings.
Let me tell you, and also everybody to realize is that what Chairman Hardaway says: if you listen to great biosafety and biosecurity protocols, we can all survive this as a community. But like he said, it's going to take folks that look like us talking to our people the same language.
Wow, that is some good information. So Dr. Rowland, I have another question here, and we're about to kind of wrap it up. And we're definitely going to come back for part 2. We got to do it, because this is some good information, and the information is constantly evolving every day. So if I talk to you in a month, I know you'll have more to share.
Oh, hell yeah. Because you know what? When I get off the phone with you guys, I'm getting me some catfish.
Yeah. Okay. So I have
I'm having salmon, Doc.
I'm gonna have some catfish and some Tabasco sauce and some cornbread.
I'm having that smoked salmon.
Okay. So hold on, let me answer this here. Okay, so Doc, I have a question here from actually a colleague of mine. She's a director of a residential home, and she's having issues with trying to figure out how to safely provide a place for someone, if they do get sick, to safely quarantine within the home, within a small home. And I know that Representative Hardaway actually kind of alluded to that whenever he was talking about some of the living conditions. Well, some environments like where I, the places that we work in, the type of work that I do, we work in homes where they're residential. And so my colleague is asking, working in a residential home, how do you suggest that one, she provides safety for the 6 people that live in this home on the 3 different floors, that just an ideal of what do you think that she could do to keep everyone safe? I did tell her that I use Hibiclens because I learned that from you.
Well, my question is, why hasn't she called Dr. Rowland already? And so we can implement and give her biosafety and biosecurity protocols for everybody in a residential living facility on how to wash your hands, what technology you have to have. Are the people wearing shoes? What air filtration unit they have in that facility? What are they doing for the bathroom? Do they have lids on the toilet? What's in your air conditioning unit? Has that facility actually been tested for the SARS-CoV virus? Because we know that buildings, facilities, you can find the SARS-CoV virus on vacuum cleaner handles, wheelchairs, beds, air conditioner, ATM machines. If she implements these biosafety, biosecurity protocols that we have developed, she can have a nice safety environment for the people in her facility, even period, end of story.
Okay. And whenever someone is quarantining in their homes, and let's say they share a space, do you suggest that person stay in one room? Everything is done in that room. I mean, how do you suggest?
My suggestion, like Chairman Hardaway, the biggest problem among minorities is that we're so dense in population. We have multi-generation people living in a 2-bedroom house in New York, apartment, Chicago, Memphis. Even if grandmother is infected with the SARS-CoV virus in another room, if you put in biosafety protocols, i.e., you have air filtration unit, i.e., the bathroom is sterilized every time that individual uses that bathroom, you're washing your hands with antiseptic hand wash, you're making sure your dishes and boxes are sprayed, no shoes, i.e., you can keep grandmother or mom or father in that room, in that same facility or that apartment or house. 100%, I guarantee you, no problem.
Okay. All right. So the last couple questions is from one of our viewers. His name is Jerry Wright. He is a fellow service member, so and Army at that. And his questions are: so the first one is, what is, if any, the reinfection rate?
Well, the reinfection rate is very important. That's why people need to understand, even though you get the infection the first time, because of the 12,000 different mutations that the SARS-CoV virus has, you can get reinfected again. This is a game changer. You do not get conferred immunity because you get infected the first time. So you have to have what we call great biosafety security protocols for yourself, i.e., wash your hands, keep your nails cut short, i.e., not wearing your shoes in the house. If you have a pet, make sure you desanitize your pet's feet when they come inside to the house, because that can be transmitted disease. Making sure if you go to Walgreens, you black folks like that dollar store, making sure you get packages out of there, you sterilizing that stuff.
Right.
If you touch a cart at Walmart or Piggly Wigglies, I think that's what y'all, what is that, Piggly Wigglies? What y'all eating at now?
I shop at Mom's Organic, sir.
Did you say Black Organic?
Mom's Organic.
You sterilize that cart. You do this the great practical sense. Flies, feces, food, formite, face, foot, and fingers, and respiratory, you will be safe. And so tell that Army guy, because he's probably a leg, which means he's not like I am, jumping helicopters. He's good to go. What's your second?
Say it again.
What's your second question?
Okay, his second question is, how long is a person contagious?
A person can be contagious with this SARS-CoV virus anywhere from 21 to 35 days after infection. So we're looking at anywhere from 4 to 6 weeks. People become infected with disease within 8 hours of the infection.
Excuse me. Doesn't it seem like the information is a little misleading? Like when you're saying that, like I've never heard that, and of course I don't watch the news as much anymore, so I could have missed it. But
I have a degree in virology.
yeah. It just seems like the information is misleading, right? It seems like the information isn't out. Like I've never heard that answer, only from you, of course.
Hey, girl. Hey, I'm on my third cognac. Chairman, why don't you talk to him about Fox? Because you're an elected politician.
Oh my God! Wait. Let me get through these other questions. And I'll let you have it. Okay. So this kind of ties into the question. The next one is the 14-day quarantine really long enough? Basically, not what you just said.
No, probably the most infectious part of somebody being infected is on day 8.
Ooh.
Producing the maximum amount of viruses that you can pick up, you're breathing out. But a person can be infected or be infectious within 8 hours. Once that virus gets in your body through your eyeballs, let me explain how you get infected with the virus. Eyes, nose, throat, lungs, kidneys, gastrointestinal tract. Once that virus gets in contact with that cell, that individual cell, it takes about 8 hours from the time it gets contact for that virus is making lots and lots of babies inside the cell, and that virus kills that cell, so you can't smell anymore. You lose your taste. You can't breathe anymore, and you're infectious. So usually about 8 hours from the time you contract that infection, you are a carrier or you're spreading to other people. That's virology.
Wow.
This is not an aliens movie or some zombie movies. This is not Fox News.
Oh my goodness. I want y'all to share this information out. That is so, that's something to really think about. Like that's almost, it seems like instantaneously.
Sarah Harmony, come on, man. You said you got my back. You said tell these folks what's going on in reality. Go for it, Chairman.
He's on mute.
You got yourself on mute, man.
Yeah.
You're drinking too much. Get yourself off of mute.
I don't think he's been drinking anything. I didn't see him put anything up.
Fool you. Don't let him fool you.
Okay.
Chairman Hardaway.
He's on mute. So he's on mute. I'm gonna let him. Okay, there we go.
Okay, but what Doc is saying is accurate. What you're talking about is accurate. How there's bad information out there. Look at how CDC has to keep coming back and amending their recommendations.
Yeah.
And they're chasing the curve. They're chasing that knowledge. What they're telling you to do, Doc has already told you weeks ago or months ago. So they'll tell you this limited amount of information, and they'll give you this advice, which goes to a certain limit. And then they'll come back in another couple of weeks, a month, and say, well, yeah, in addition to that, here's this, or don't do this. Doc has already told you about it. When they're finally coming around, well, maybe they're coming around to admitting that it's transmitted through aerosol, but they put it on, then they took it off. That's what happens when you let propaganda and politics start to outweigh your judgment against good public policy. Good, sound public policy ain't always good politics. So you have to make a decision. Are you going to look after your people, or you're looking after your political aims? Are you putting out propaganda, or are you putting out some truth that will actually save lives, that will help the community to recover from this pandemic? So you've got to be smart enough to recognize that there's some undue influence on everything flowing out of government now. So you've got to do your own research. Those of you who have tuned in today, that's what you've got to do. You've got to go to other expert sources and get the real story.
Oh my
goodness. Because you've got to have something to weigh this propaganda against. And that means you've got to do your own research. Go to another source, do your own evaluations, and it can save your lives. Right. Don't pay that stupid tax.
Thank you so much for that. I'm wrapping up. So I have one other question for you, Dr. Rowland. Why does COVID-19 cause weakness in the legs? That is also from Jerry Wright.
The reason why the COVID-19 causes weakness in the leg, because of COVID-19, not the COVID-19 disease. This, I want people to understand, it's the SARS-CoV virus, number 2, that causes the COVID-19 disease. But the SARS-CoV virus has the ability to attach to all vessels in your body.
Oh.
Arteries, your brain vessels, and your leg vessels. And a lot of people end up with deep vein thrombosis or clots in their leg, which means they have decreased circulation, pain, and decreased energy and blood flow to your legs. That is what causes the weakness and can cause you to have a pulmonary embolus, and you can die from a pulmonary embolus, which is legs.
Okay. So Doc, I want to say this, and you can, of course, expound on it. We do not have to, I mean, not everyone dies from having this virus.
No,
right?
not everybody diseases, but the bottom line at the end of the day, Queenie Love, show me your glass of cognac, please.
I have chocolate wine.
The bottom line, when it comes down to it, it's about exposure. How much load you get, how much viral load. Do you have your mask? So if I got 10 people coughing in my face and I don't wear a mask, I'm going to get sick. I'm going to die within 14 days.
Wow.
If I have a mask on, it protects me. Doesn't matter if it's a cloth mask, any type of mask, it's going to give me some protection. So to your question is that is where we're at. The disinformation in our world, when Chairman Hardaway put me on the Black Congressional Caucus for the nation, my responsibility is to educate Black folks about science and medicine so we can stop this horrific disease from killing our people, period. And I'm still Queen Love.
Yeah. Thank you so much for that. So lastly, the last question is, any books from the panel members, and where can we get them? So does anyone have any books written? I don't know, Doc, if you have any. I mean, I know you've written tons of information currently.
I think some of the most important books that we have to understand, and what I teach when I certify people in infectious diseases in Germany and Peru, is that you have to understand the past to move forward in the future. I think everybody should get a book, the 1918, and understand how the Spanish flu went about. How did they read about the bubonic plague? You need to read books about why diseases affect people, i.e., in 1492, Columbus sailed the ocean blue. He landed in the country of Hispaniola, which is Haiti and Dominican Republic. Hey, guess what? Columbus he brought smallpox out the Indians, and the Indians gave Columbus and them guys syphilis. And world meet new world. Columbus went back to Spain and passed syphilis throughout the whole world. And my point is that you have to understand diseases. If you understand the history, the bubonic plague, that this pandemic is going to go on for 10 years, folks. This is not going to end next year. It's not going to end in 5 years. And me and Fauci were supposed to do a program together, and it's going to be a game changer. Like Ali said, I'm rocking the world.
I have to thank you so much for coming to do part 1 with me, and I look forward to part 2. And I want to invite each one of you back, because I just feel that, again, the more we know, the better off we are. And I'm hoping that people will listen to them and really take it to heart what you're saying, because as I've shared with you before, you speak to the heart. Like right now we're having a good time, right? We're having a good time. We're having this conversation, and it's happy hour and it's after hours. But I've seen you in the morning have a serious conversation about this virus, and you are just as passionate as you are tonight. You are just that passionate in the morning when there are no drinks at the bar and we're not having a great time laughing. You are extremely passionate and extremely informative, and you're speaking to us to help to save us. And I appreciate that.
Well, I'm gonna tell you right now, this part 2 talking about Fireside with Dr. Roland and a glass of wine. I ain't drinking no damn wine. I'm gonna give me some Mad Dog 2020.
No, what? Mad Dog 2020 is not welcome here, because the whole year we need to throw it away. Okay, so we throw the whole year away. We ain't doing it.
What you think, Chairman Hardaway? What you gonna drink?
You gotta bring some better stuff to 2020.
We're gonna stick with Black folks. We're gonna do some Uncle Nearest.
Oh
That's
Lord.
the
Oh Lord.
yeah, that's the Tennessee whiskey that the Jack Daniels stole the recipe from a black
Yeah.
slave. That's the black slave is who actually delivered the recipe for Jack Daniels.
Yeah, I
But
heard
there
that.
was a black woman and her family that found out the story and subsequently opened a distillery, and they're now producing that slave's whiskey. And his
Ooh.
name was Uncle Nearest, and they put his name on the whiskey itself.
Oh.
So Doc, I'm gonna send you a bottle.
I love
Oh
it.
my
Hey,
goodness. I gotta do a little research on that.
Pastor Super, I know you are religious, but man, I guess you all gonna have what eggnog. And stuff.
He's a mess. He's a mess. So
Eggnog.
Almost done. I want to tell you guys this has been one of the most funnest podcasts I've ever done. I'm talking about, man, I mean, Queen Love. I don't know what you're drinking. I know you sober right now, Chairman Hardaway. I got the supers over there drinking eggnog. And I can say right now, next time I'm gonna have Mad Dog 2020.
you know, sir, if that's what you want to bring, I mean, I guess it's okay. I'm gonna reach on the top shelf. I'm gonna let you have that from the 7-Eleven. No shade, 7-Eleven. No shade.
Well,
So,
I want to thank Queenie Love, and I have a great
thank
deal of love and respect. There's no words to say for your burying your father yesterday from the COVID-19 infection, but it's real. Chairman Hardaway, you've always have got my back. The juice, the supers over there. I love you guys. You non-drinking eggnog, drinking rum. Folk. I understand how you guys feel, and I'm definitely gonna drink me some Mad Dog 2020 because it's the year 20, and our next.
I think you seem like you're the only one that's extremely happy in 2020. Like we're all over here like stressed out.
That MD 2020 will get you happy.
Right? Yeah, he's all happy about it. One last question before we go, and I think we still have Miss Harris with us. But one last question before we go to Charlotte and your husband. I didn't catch his name. I know it's Pastor Suber, I think it is. When you are ministering in church, are you ministering this information to your congregants? Like, are you talking to them at this level about the severity and seriousness of COVID-19?
Yes. Now, and I'm Pastor Larry Suber.
Okay,
and,
thank you.
and you know, all truth is parallel.
Yeah.
So I don't cut corners. I don't bite my tongue. You know, real is real. And like I said, I'm not gonna go along to get along. And there's too many people that don't have this knowledge. So so whether I'm doing a Bible study, I'm doing a lesson. If my wife is in the surgery and I'm helping her, I'm talking about how to help people because we have that audience, we have that ear. So no matter who I'm talking to, no matter, I'm giving them the truth. I'm giving them, but I also acknowledge Dr. Lane Rowland. I'll tag him on a live.
Yeah.
And sometimes he'll come in and I say, listen, this is the brother I was telling you all about. Make sure you go to his page, look at the articles, listen to the videos, and learn from this and live.
Yeah. Learn from it and live. Yes.
So yeah, I don't
So hey, so we're gonna do part 2. It's gonna be the bar talk, a glass of wine for all the other participants in Mad Dog 2020 for Dr. Rowland. Part. When are we gonna do it? We're gonna do it in 1 month.
1 month. 1 month. 1 month from the day. I'm putting it in my notes right now. 1 month.
Hey, you make sure you can post this to your people so people can see this around the world.
Yeah.
It's like Chairman Hardaway, we got to save people and save lives and stuff. Yeah. And like 8 more minutes of happy hour.
Yeah.
I'm gonna drink more vodka and orange juice so I can.
Well, listen, I've really had a great time. I'm so thankful. I'm thankful tons of. I didn't even get through all of the questions, but I did get through the majority. So I'm thankful for the viewers and them sending in their questions. And I'm grateful that you brought guests. This is huge fun. So Representative Hardaway, it's been a pleasure talking with you. You are definitely welcome to come back anytime. I hope you can join me in a month. And B. Harris, I hope you can join us in a month. And I would love then for you to come and contribute more. I know that you're busy and working, but you are here and you're listening. So I'm thankful for you and your presence. And to the beautiful couple, the Subers, thank you so much for joining us. I see Dr. Rowland, he knows really
Thank
cool
you.
people. So anytime you want to bring more guests, just bring them on. I would ask that everyone that's watching, please share this information. Share the broadcast. It'll be up. It'll stay up on YouTube. I will have one of the on Bar Talks, the podcast on Facebook. I'll put another link up so you can actually share that one as well. Share it, text it to someone. Just allow people to they don't have to watch it. They can just listen. The information is huge, and we need it to keep our families as safe as possible. So please continue to share this. And Dr. Rowland, I owe you so much. Thank you so much.
So thank you guys. Thank everybody. Go because I got my catfish cooking. I got okra. I'm gonna give you any yam, some cornbread. I'm gonna have a cold 7-Up and some Tabasco sauce.
Oh my God! It
Sounds like a feast, sir.
Oh my goodness.
Yeah, right.
Well, Bar Talks family, I just want to say thank you before I end the broadcast. Everyone, you can stay in studio for a couple seconds so we can exchange information. But to my Bar Talks family, thank you so much. I'm going to end the broadcast, but I'm grateful for your presence, and I am honored to have you here today, and I'll see you on the next